According to the Centers for Disease Control and Prevention, America experienced a significant increase in fatal opioid overdoses. Between 1999 and 2017, the number of annual deaths by opioid overdose increased from approximately 8,000 to 48,000. Although disputed, many link the growth in opioid addiction to the widespread prescription of oxycodone for medical pain relief. The availability of the powerful synthetic opioid, fentanyl, is another contributing factor. Currently, there is only one available remedy for opioid overdoses. Naloxone, marketed as Narcan, can be administered by injection or nasal spray. For some overdose victims treated quickly enough, Narcan can prevent brain injury and death. 40-plus states, including Virginia, have made legislative moves to make Narcan more available to the public. Despite growing availability of Narcan, however, overdose fatalities continue to rise. Why? One explanation could be that an increased sense of safety can simultaneously bring about an increase in risky behavior, a phenomenon some have called a moral hazard. And indeed, some recent controversial studies suggest that higher rates of fatal opioid overdose can be found in areas with public Narcan accessibility. In response to the rising level of fatal opioid overdoses, a national foundation is donating thousands of Narcan kits to public and private universities. You serve in your university's student government, and you must decide whether or not to accept Narcan on your campus. As you hear various perspectives, be curious about the ethical questions your team must address while deciding.
Overdoses of fentanyl, the deadliest drug in America, happen fast and are growing more powerful. So it is important that Narcan be available where the opioid users are. If the university decides to provide Narcan, it is vital that the supply be readily available to the general population. It could be life-saving. Statistics indicate that laypersons administering Narcan have saved nearly 26,000 lives in the past 20 years. There are no known side effects or risks to Narcan. You cannot harm someone by giving it to them by mistake. But you can save lives. So make it available.
I've been on calls to overdose victims. Reviving someone is intense and requires professional training and careful monitoring. If Narcan is available to students, say at a party, people may hesitate to call 911 because they think they can handle things themselves and they don't want to get in trouble. They may not know that Narcan is metabolized faster than opioids, so there's a real danger of rebound overdose after being revived. And if the brain loses oxygen, even for just a short time, the results can be permanent. Reviving someone should be left to trained professionals. We should be called whenever a student faces a medical emergency, and an overdose is an emergency. Waiting to call can be fatal.
I run into misconceptions about opioid addiction all the time. I had a sports injury and was prescribed opioids by my medical doctor. I know what it's like to be addicted to pain medication. I'm in recovery now, but unless you've been in that situation, I'm not sure you can understand. Now, it may be that some students experiment. I don't think they know how dangerous that can be, but we live in a free country. People can do what they want, right? That shouldn't stop us from offering help to those who really need it. So make the Narcan available to students. I know many of us will feel a lot safer with it around. And let us choose when and where to use it.
I certainly didn't send my son off to college with the expectation that the university would encourage opioid use. I think bringing Narcan to campus is exactly that type of encouragement. I worry about him living and working in a residence hall where he might be put in danger by someone else's addiction, or be put in the awful position of having to revive one of his friends or residents. That's unfair. He chose this college to get a good education, and bringing Narcan to campus sends a very different message about college life. Is that what the university really wants to be known for?
Our university recently experienced an opioid overdose death. I had her in class, and she was a good student. You would never know it, but she was addicted to medically prescribed oxycodone following an accident. She tried, but she could not kick the addiction. And my fear is that if the university accepts Narcan, then that would unintentionally send the wrong message. Narcan could give false hope to those who are struggling, and that is where all the resources and the support should go, to help those struggling. I know some medical professionals are in favor of Narcan because it saves lives, but my economist colleagues have told me of research suggesting that Narcan availability could perversely increase the number of people who try opioids. I really care for these students, and so I say no Narcan. As harsh as it sounds, no tolerance is the best chance for saving lives.
My office looks at the opioid addiction crisis in the region. In terms of fairly distributing resources, there are areas in which people really need Narcan. Honestly, college campuses are already well served. If the Foundation wanted to effectively save lives and respond to the rights of those who may not be able to afford the same quality of health care available to university students, I would be happy to tell them where the Narcan kits would do the most good: the inner city and rural areas. I guess I question the motives of the Foundation and the university. Do they want to do good or look good?